Hello everyone, myself Kailash Kumar Dani and my group members are Ankit Singh and Palash Kaur. And the topic of our case study is on research on the area of digitization of a healthcare company. Coming to the problem, given a large company with around 1000 plus employees working in manufacturing medical equipment for diagnostics. In this, we have given that we are a part of the company's product and engineering team and we have to decide priorities for the next year. Given problem statement that we have to do research on digitizing healthcare and create a mobile app for monitoring data. Now, coming to various challenges. Challenge 1, need to do research on area of digitization of healthcare and its potential for monitoring stress. Challenge 2, creating a mobile app for continuous data recording. Challenge 3, partnering with smartwatch companies for data monitoring with the help of cloud. Now, we are going to address various questions related to this case study. First question is, study and describe company externally using the method of domain, customer, product and strategy. Let's begin with domain. Company works in one of the most crucial and important sectors in healthcare industry, manufacturing medical equipment for diagnostics. Customer, hospitals, clinics are primary customers of the company and individuals can use at home for health monitoring. Product, stress test machines, blood pressure monitors, cardiogram, CT scanners are manufactured by company. Strategy, main focus of the company is in enhancing digital health monitoring and developing mobile app and collaborating with smartwatch companies for healthcare and data analysis.
Hello, I'm Ankit Singh and I will be continuing with the presentation. So our next question is that what kind of data would we be collecting, and we also have to research on it and discuss how the company can potentially use data science and data analysis to provide valuable insights to the customer. So the answer to this question basically is that we can take a variety of data types, like medical data has ECG readings, blood pressure readings, etc., heart rate, activity levels, and other patient generated data like symptoms, what is their lifestyle, how much calories do they intake, and the frequency, how they basically how frequently they are deceased. And these are the various data types which can be the columns basically in our data set. And data science usage, that is how data science and analysis can be used to provide invaluable insights for the patients for their well-being. We can use a variety of use cases like pattern detection, predictive analytics, personalized recommendations, and population health insights, which are basically different kinds of machine learning algorithms. Like in pattern detection, we can identify subtle patterns and anomalies in patient data for early disease detection and outliers, like what kind of situation has arisen with the patient that is not common with other patients, so that can give rise to like a new situation, a new disease. Predictive analysis is nothing, just we will be using the existing data and some algorithms like regression and classification to predict other health risks and outcomes based on the previous pre-patient data. And these can be used for personalized recommendations that offer very tailored lifestyle recommendations and health advice. And population health insights is nothing but we analyze the data of patients across different groups for diagnostic accuracy and treatment plans. And moving on to the next question, the question is that if we wanted to use machine learning for analyzing the data sorry, and coming up with recommendations to customers on lifestyle changes based on their health data, current lifestyle, and what has worked for other people like them in the past, what kind of machine learning model would you use, and at a high level how would it work, what kind of data inputs would be used, and what kind of output can be expected. So this is nothing but basically a continuation of the previous problem. That is, we have to explain our solution more in depth in comparison to the previous problem. That is, it is just the in-depth analysis of the continuation of how data analysis and machine learning algorithms can be used in the field of healthcare or health apps. So machine learning for health recommendations can be used in broadly. It basically uses three varieties, that is model type, data inputs and output. Here model type can be anything like we previously talked about classification and regression, and a recommendation system that combines filtering that is based on behavior and preferences, and other characteristics of items would be apt. The hybrid approach that would provide personalized recommendations while also taking into account the patient's health history and similar patient profiles. This is basically machine learning algorithm that is collaborative filtering and content based filtering, which basically filters out the patient data. And the data inputs can be inputs to the model, which include patient health data like vitals, lab results, historical records, and also anomaly that is detected in other kinds of patients with similar health profiles that can be used to differentiate between the diseases between two different patients but they have similar health profiles. And the output can be tailored to comprise lifestyle recommendations and health advice. For example, it might suggest specific diet changes, routines, or medication adjustments based on the patient's health data, and has been effective for individuals with similar health histories, which basically machine learning algorithms in general, they can be also used to create a digital twin. Now what is a digital twin? So basically digital twin is nothing like uh, previously only the historical data about patients was stored using papers and files which were difficult to find and process. So digital twin is the same thing but in a digital manner, which can be stored in websites, in data warehouses, databases, and it becomes quite easy to process and generate results and basically predict what kind of future problems can this patient of a certain health group can have. So now my friend Palash Kanwar will be continuing on with the presentation.
So, on to the next question, which is related to quality assurance and testing. The question goes, what are some of the quality testing related challenges and risks you see for this product and product line which will need to account for? Well, one of the challenges is data privacy. The company and its partnered companies has to work closely and maintain strong communication to avoid data breaches during all parts of production process. Next challenge is compliance. The government has laws and regulations pertaining to the healthcare sector. Also, there are various international bodies which regulate these compliance laws, so meeting regulatory requirements is necessary. Otherwise, backlash and hefty fines ensues. The last challenge is interoperability. The engineering team has to make sure of the functionality of the mobile application on various devices, operating system versions, and external systems. So these were the challenges, and now the discussion will proceed towards risk prevention. To mitigate data breaches, implementing robust data encryption, access controls, and simulating data breaches for testing and vulnerability assessment is essential. Next is compliance violation. Engaging with compliance experts for thorough auditing and testing against regulatory standards is vital in avoiding compliance violations. The last is functional issues. Comprehensive testing, including usability, functionality, and security testing with rigorous bug tracking and fixing, will remove bugs or glitches that affect the accuracy of health data or recommendations. On to the next question. What will you use for testing your mobile app, and give key scenarios you would be testing for? What can you do to keep Android and iOS app releases in sync? What are some of the best practices companies use for this? One of the scenarios on which testing will be done is data security. The engineering team has to verify that data is encrypted at all times and test user authentication and access controls to prevent unauthorized access. Next is usability testing to ensure that the application is intuitive and easy to navigate. Also, checking for any inconsistency in design and user interface elements comes under this scenario. Next scenario is compatibility testing to test the application on various devices like phones and tablets and different operating system versions, and to verify that the application adapts to different screen sizes and resolutions. The next scenario is performance testing to ensure the application's responsiveness, speed, and resource usage, and to test the application under various network conditions like 3G, 4G, Wi-Fi, etc. The last scenario is push notifications, which will ensure that push notifications are delivered accurately and on time, and to verify that the users can enable or disable notifications as per their preferences. And the last thing, to keep the Android and iOS app releases in sync, employing a DevOps approach with automated build and releasing pipelines is feasible. To summarize, the research case study analysis had been done on the healthcare sector with data science applications and quality assurance and testing with mobile app development. With these remarks, this presentation is concluded. Thanks for your patience.